Hello, everyone. Thank you for taking the time out to come with us to participate in this information sharing session. I want to introduce David Miller. David Miller joined the faculty of the Department of Computer Science at its founding in 1981. He served as an associate dean for the School of Computer Science, Telecommunications, and Information Systems, CTI, back as it was known when I was attending it, since the school's inception in 1995, and began serving as dean of what is now the College of Computing and Digital Media in 2005. Miller served as DePaul's interim provost for the 2014 to 2015 academic year. Miller also received his doctorate in mathematics from the University of Chicago. He still satisfies his programming bug by contributing to open source software development. Please welcome David Miller.
Thank you, Carlos, and welcome everybody. As I listen to that, the part I like the best is I'm still programming. It's, you have to keep scratching that itch somehow or another. I've been asked to sort of give an update on the things we've been doing in CDM with a particular emphasis on our reaction to the current pandemic situation and the efforts that have been going on. I'd like to take you back into a simpler time, by which I mean March. If you remember March, life was somewhat simpler, if I remember back then. That's the time when DePaul had to make some very rapid decisions to deal with the situations we were facing at that time, and we made a decision roughly in mid-March to take ourselves completely online for spring quarter. And that included also the finals for fall quarter were to be taken off campus too. We were lucky in some ways, DePaul being on the quarter system. The timing of this was right at the end of winter quarter, and so it was pretty easy to let's say much easier for us to pivot than schools that were mid-semester at that point and had to basically move all their instruction online as they were moving through the quarter or the semester. So for us, at least, the faculty responded extremely quickly, as did students, to first of all taking the finals online, and then we had, I want to say, the luxury of 2 weeks roughly. Of course, that was the same 2 weeks when they were moving the finals online and doing all the grading, that the faculty had to adjust and figure out how to offer everything we were doing in an online format. For the university as a whole, that was about 4,000 courses that had to be moved. For CDM, the exact count for us was 496 courses being offered in spring quarter. Now, we had some prior experience doing this. Some of you have experienced that, obviously, that we do online. Typically 45% in any given quarter of our graduate credit hours are done online. It's a somewhat smaller percentage for undergraduate. But as many of you know, we did a lot of that through lecture capture, the course online system, COL. And of course, suddenly there are no more lectures to capture. So lecture capture system suddenly was no longer in play. People had to move to completely other methodologies to deliver. We had some experience with that. DePaul has been doing a fair amount of online in various modes. We have technologies for delivering that. We have a program called DOTS, the DePaul Online Teaching Series, or I forget the exact acronym, that has trained hundreds of our faculty across DePaul to deliver online education in a high quality function. We also have something called the Teaching Learning Center and an area called FITS, which provides instructional design help. Those folks just jumped in during the period between quarters and the early part of the quarters to provide lots of additional training. In particular, there's all of a sudden a lot of movement to doing things like Zoom and other forms of asynchronous modes of delivery that we had not really spent a lot of time doing. It really was an incredible accomplishment for our faculty, and our students, of course, had to adapt to all of that too in a very stressful time period. We did make other accommodations to help make it easier for students. For example, we provided an option for students to not get regular grading, to go to a pass, D, fail option for courses, because we understood that the circumstances for the students here are so many different pressures on students who might have lost work, who are suddenly had to move out of the dorms and go cross country or move back in with their parents and make an incredible number of adjustments just to get through the quarter. So we were trying to do our best to make sure that the impact on them was minimized to the extent possible. Beyond that, outside the classroom, other things were taking place that were also dealing with this current pandemic situation. One of our major focus today really is, of course, the efforts of Jay Margulis and our students in our makerspace to create PPE and other efforts along those lines. So I'm going to leave that aside for now, and because you're going to hear a lot more about that shortly. But there have been other efforts that have been taking place on the faculty side. DePaul, for example, set aside some of their research funds specifically for COVID-related projects, and we've had some of those funded internally. Bamshad Mobasher, for example, who's a professor in the School of Computing, does a lot of work in social media. And during crises, social media are used by emergency responders and the media and the public to disseminate information and also to search for it. The problem, of course, is determining which pieces of information are credible and how to avoid or at least identify false rumors and other kinds of misinformation, particularly because they can hamper crisis communications and other mitigation efforts. So Professor Mobasher's project is aiming to develop automatic methods for misinformation detection on social media in a crisis context. I'm quoting here. That will use the techniques of natural language processing and other machine learning methods to, quote, extract salient features from social media posts related to COVID-19 and perform detailed analysis. And so that work is ongoing. Enid Montague, an associate professor in the School of Computing, does a lot of work in health systems in general. And of course, that's rather front and center in the current situation. Both, she does a lot of work with relation to design and the delivery of information systems to health professionals. This was ongoing work well before this. And of course, there's an increased amount of work dealing with telehealth and figuring out ways to reduce things like physician burnout. That was certainly before the pandemic. Our healthcare system struggled to provide optimal care as the patient population continues to increase, and COVID-19 certainly exacerbates those challenges. In particular, also diagnosis and treatment for other things, in particular chronic conditions, which is one of Professor Montague's areas of interest. A lot of that is being delayed because of people avoiding the healthcare system and other types of infectious disease controls. So her work is on the long-term goal of it is to boost health and well-being by using automation to enhance physician capabilities to serve more patients without exacerbating existing challenges. So it basically is taking a look at existing work she's been doing and extending it into the current environment. Outside of DePaul, Professor Daniela Stanraiku, who's in the School of Computing, has been working with the city of Chicago to predict missing information in the COVID-19 patient data. In particular, there's a lot of data missing with regard to race of patients in the system data. And as you know, there's a great deal of interest in trying to suss out the disparate impact on different communities of COVID-19 and the ability to improve that data so that we can better understand those impacts is absolutely crucial. And so we think we're very happy with that work taking place. Looking forward to fall quarter, we're just it's in process. It's always in process. DePaul currently is doing its best to figure out how to provide an on-campus experience for those students who want it, to the extent that it's safely possible to do so. some students are not going to want to be back on campus, and for some students, it's not such a big deal. For example, in the master's students, they were already 45% online, so presumably a number of them won't mind another quarter where everything is online for them, since they were already electing to do that quite a bit. But there's a great deal of concern, particularly when you're looking at the kind of experiences, for example, incoming freshmen want to have as part of a university experience, that we do our best to try to provide that. The problem is figuring out how to do that safely. It's a comprehensive effort across the entire university, and it ranges from things like reducing the utilization of dorms, so that we don't have, reducing how many beds are available in the dorms so that there's less doubling up in a number of our rooms. Also reserving some dorm areas completely for quarantine, so that when students do have to quarantine, we can put them into a separate facility. We can make sure that they're taken care of, that their meals get delivered, everything else, so that experience is acceptable for them, and reduce the stress of that as much as possible. We have to do things like arrange for early student arrivals much earlier than normal, because Chicago is requiring quarantining for 2 weeks for students who will be traveling in from states that have been designated as part of the travel quarantine ban. So we've had to open up the dorms early to make that possible. And also open them up late. For example, we've delayed athletics program training sessions so that the athletes are actually coming in later than normal, because, again, we're trying to reduce the amount of time that they are here and exposed. How do you make our spaces safe? Enhanced cleaning is certainly there. Reducing the enrollment, for example, in our on-campus classes will only be running at 1/3 capacity, so that we can maintain social distancing in the classrooms. Try not to schedule, all the classrooms on the floor at the same time, so you reduce hallway traffic. Don't do back-to-back scheduling on classrooms. So there's a long enough period in between to go in and let things settle, as they say. And also to do additional cleaning in between classes. We've reduced the fees that are being charged. Like, we couldn't very well justify the full athletic fee, for example, for a fall quarter, since there's not going to be as much going on there. We also rolled back the tuition increase that had been planned for the coming year in order to reduce the pressure on student budgets. One of the things that's happening is we just had to figure out lots of different ways to deliver campus our courses. In the spring, a really phenomenal job done by the faculty to just in 2 weeks just shift everything online. Now we have a little more time to plan and think and go through our curriculum and decide what absolutely essentially has to be here, what can really very effectively be done online, what has a preferred mode of on campus. And the university as a whole has identified the courses that we think absolutely have to be on campus. For example, a chemistry lab course is very difficult to replicate in an online-only situation. And also trying to prioritize the incoming freshman experience for those who are going to be here with us on campus. So we're delivering courses on campus. We're delivering courses on campus in Zoom rooms with asynchronous online. So 15 students maybe in the classroom, and 25 students are sitting online watching it synchronously as the course takes place. Or we're recording the classes for asynchronous, or we're doing both. Or we have, if we have a Tuesday, Thursday schedule, 15 students can come in on Tuesday, and 15 students can come into campus on Thursday, and then plus another 10 students. If you're not in class on Tuesday, then you're watching the class synchronously and being joined by other students who may not be in class other than online. As part of some of the funding we've gotten from the federal government, as part of what's called the CARES package, that was designed to help reduce the effects of this movement online, both on students in terms of financial aid, additional financial aid assistance, but also money for universities to cope. We've gotten money, for example, to take an additional 100 classrooms and Zoom enable them so that we can do more of this synchronous offerings. And keep in mind that this could all change at any time. If the city goes back to stage 3 or worse, we have to be prepared at any time during this upcoming quarter to pivot. It's going to be a lot of stress on all of us in order to make all this happen. I'm happy to say staff, faculty, and students also are stepping forward to make this happen. That's not to say the only thing happening in our world is about COVID. Life goes on in the rest of what we're doing. We have new degrees that are starting to come together and will be offered within the next year or so. One example is the BFA in industrial design. I hope I said that right. The internal name is ID, and I occasionally have to not refer to it as the BFA in intelligent design. It's the BFA in industrial design. It's part of our overall movement into the physical world. It started with our some courses in circuitry and embedded devices that culminated in our undergraduate degree in cyber-physical systems engineering. That also is part of the development of our makerspaces, the IRL, that Jay will be talking about momentarily, and related efforts there. We also are bringing up a Master's of Science in Artificial Intelligence. If you've been paying attention, AI is increasingly in the news these days and increasingly in the forefront of technology offerings. We've been doing AI forever. I can say that confidently because I created a lot of the AI courses back in the early 80s. We are adding to those offerings, making them, they've been up to date, but adding new offerings and just making the program more visible. We continue to have top-ranked programs. The film school, the 4th year in a row, has been in Variety's top film schools in the U.S. The graphic design program has, for several years now, been listed among the top USA design schools, graphic design schools. Princeton Review and Animation Career Review continues to list our programs in game design and animation very highly across programs nationally. Other things are Brian Andrews in School of Cinematic Arts recently did a virtual reality film called Hamadeh that has to be seen to be believed, but it screened at Sundance recently and also was part of the XR showcase at the Cannes Film Festival. Our students in the Experience Design degree program in the School of Design helped with the City of Chicago's new design and website branding recently. Our undergraduate research experience program called MEDICS, that's sponsored by the National Science Foundation, is at 15 years and counting and just got another $400,000 grant to continue it for 3 more years. This brings in students every summer to do research primarily in image, and they do a lot of image and data science and health-related type image recognition work. And so the list goes on and on. We continue to do what we do, which first and foremost is to try to provide the best education we possibly can for our students in this changing environment. That commitment is unwavering, and we will continue to provide that education in any way we have to do it going forward. I'm extremely proud of our staff and our faculty and our students in what they've accomplished in these recent times, and look forward to being in the trenches with them as we move forward into fall. So that's my update on the current environment. And we'll have time for questions later. Now I'd like to introduce Jay Margulis, who will talk a little bit about our efforts in COVID using our makerspace facilities. My introduction for Jay is he is a faculty member in the School of Design. We originally hired him primarily for game design, and we get really lucky. Some days, game design was why we brought him in, but it turns out that Jay has tremendous prior experience before joining us in doing things like creating makerspaces and creating particularly makerspaces that are run by the participants in those spaces. So as we started to make a movement into a more online experience, physical world experiences that I mentioned earlier, Jay was sitting right there and came up with the idea and vision for the IRL that he's going to be talking about, and really pushed it forward and has created a really phenomenal facility and has been doing great work in organizing all this effort to produce PPE and related things he's going to be talking about. In addition, the industrial, I'm saying it right? The industrial design degree that I mentioned earlier is also very much reliant upon his ideas and creativity in putting that program together. So we hired him for game design, but boy, that's something that has paid off in so many other ways as he's been here working on these things. And so with that introduction, I turn it over to Jay Margulis.
Thank you, Dean Miller. And Jake, if you want to hop in here too, I have one of my IRL lab specialists recently graduated from DePaul University. Congratulations, Jake, who's going to be talking about his involvement with our PPE efforts. And I'm going to switch real quick over to sharing my screen. Don't worry, this isn't going to be a slide-heavy presentation, but I have pictures for you. And sometimes, as they say, pictures tell 1,000 words. So I'm going to share my screen here. And we're going to go into present mode, like so. Okay, so hi, everybody. My name is Jay Margulis. And as Dean Miller mentioned, I run our makerspaces at DePaul University. I occasionally teach game design courses and now also teach industrial design courses in the School of Design and CDM. And with me I have, and Jake, I'll let you take over your own introduction.
All right. Hi, I'm Jake Jaraka. I'm a recent graduate of DePaul University's video game design program. I started DePaul with a heavy emphasis on video game design, but through my work at the IRL, I found a new passion in 3D printing and industrial design and digital fabrication.
And I put this in the slide, Jake. I hope you don't mind, but Jake's closing out his summer term at the IRL. But if you're looking for an excellent game designer and employee, Jake is your person. So hopefully I'm not embarrassing you, Jake. But anyways.
Oh no, it's fine.
So I'm going to do some brief introductions and setting of terms of what we did with the PPE projects through the makerspaces at DePaul. Talk a little bit about the story and how we progressed through making PPE. Explain some of the reasoning behind why we did what we did, and then discuss where we're going. And if anybody on the this webinar here today wants to help, you'll have some kind of potentially, hopefully, launching points and next steps for how to get involved with us. So makerspaces, what's a makerspace? I think that's an important thing to kind of ground some of this in. And, in my view, makerspaces, first and foremost, are community spaces, and then second are spaces with all sorts of technology in them that allows people to do thinking through making. But those are my words, and since makerspaces are really more about the community, and the community in this case is primarily our students, I want to let Jake kind of talk a little bit about what does it mean to have a makerspace at DePaul, and what does that mean to you?
So for me, my experience with the IRL started a few months before I actually started working there. I discovered the IRL on a tour of campus right before I started, and saw that it was just an excellent utility for students to meet, hang out between classes, and especially use all of the incredible equipment that we have access to make whatever we want. I became a slight regular there. I learned 3D printing, which is my first exposure to that kind of technology, as well as dabbled in their woodworking programs and all of the other bits of fabrication equipment they had. And that eventually culminated in me being offered a job there, which was definitely changed the trajectory of my college career, in that when I started at DePaul, the only thing that I knew I was passionate about was video game design, and that's where I started with my major. And but on top of that, working at the IRL for the sophomore through senior year really taught me that, on top of the fully digital design that I get from game development, the physical hands-on stuff really, really speaks to me as well. And, speaking about the IRL as an employee there, I find that it's a really great way to meet other students who are passionate about very specific types of fabrication as you. Even as an employee there, I, made friends with the patrons who would come in, every day and work on their ongoing project. I would get a lot out of helping them, to utilize the space to its full extent in order to, fully bring their ideas to realization. And, I feel that I got a lot out of the IRL, especially because I was allowed to work there.
So the makerspaces at DePaul were kind of the central place where a lot of the PPE work happened. And when I say makerspaces, I mean because we also have a second one now in the Lincoln Park campus. Both spaces are free to access for students. They get access to free resources and so forth. But of course, when the pandemic started, we had to shut all of those spaces down. And if you can see in Jake's background there, we actually moved the makerspaces into our employees' bedrooms and homes, sometimes to the chagrin of their parents, who might be sleeping above some of the machines. And we began kind of, working on serving students. Of course, we also then began working on serving more than just the DePaul community, but people all around the state of Illinois. And the way that we did that was by making stuff called personal protective equipment. Most people have probably heard of that by now, but we're going to be talking about that a little bit, so I just want to ground what that is. Personal protective equipment could be anything from face shields, which are these clear things that you see in the picture in front of you right now. They typically go in front of masks so that if any liquid comes out, particularly when a patient is being intubated, that the liquid doesn't go on the mask itself, but goes on a shield. Jake's holding a picture or an actual physical artifact of one of those up right now. And so we were able to 3D print the frames for those, and then take very simple, clear sheets of plastic and put them on there, and then use rubber bands on the back or bike tubes even on occasion to secure them to people's heads. Fun story about that is that President Obama tweeted out a picture of doctors and clinicians at, I can't remember the hospital, but the picture was, they were all wearing face shields that we had fabricated at DePaul. So that was kind of a cool little story. In addition to PPE, we're also going to be talking about some tools, perhaps, that we've been making. Those tools are primarily jigs. What you see on the right-hand side here is a cereal box that was cut using a vinyl cutter, and that's a pleating jig. It allows you to, it helps you make masks. We've also been making bias tape jigs using 3D printers, and those are leaving my doorstep where they sit at an ever-increasing rate because they're incredibly useful for people who are making bias tape, which makes the strings on the masks, and it expedites the mask making process. And a couple final things that we're going to be talking about, and that you actually, some of it you see in the background in Jake's picture, is 3D printers, which are additive manufacturing machines. They take plastic and stack it up like pancakes to make an object that you design on your computer. We've got a lot of sewing machines in our makerspaces at DePaul. We liberated all of those out of the spaces as well. Vinyl cutters, which a lot of people are probably familiar with, but they take sheets of either vinyl or paper and use a small razor to cut designs out of it. And we've been using those, for instance, to make the pleating jig that I showed you. And then laser cutters, which we'll get into because we use those a lot to cut plastic that makes PPE. So what's our story? I'm going to start the story, Jake, and then I'm going to have you jump in, I think, because you play a huge part in that. So in March, April timeframe, we reached out to, I spoke with one of the associate deans in CDM, Terry Steinbach, about taking our machines out of the spaces and using them to help in the efforts to make protective equipment for doctors. This, of course, expanded after that. And Terry reached out to the dean, and everybody approved it, to their huge credit, by the way. And just as an aside, a lot of other universities and institutions did not do that. And actually, some of them ended up giving the machines to the faculty who were asking for them to make PPE after they saw DePaul setting the example. So DePaul really set the example for this. And I think that goes back to the university's mission to serve others. So that's to the university's credit. So we got all of our machines out of the spaces, and we distributed them all around our different student employees who run our maker spaces in their homes and apartments and things like that I said. The second thing we did after we got machines there is we realized that the scope of having some student employees making PPE, while noble, was not great enough to handle the demand. And at that point, we began reaching out to other partners that we have, basically a lot of people who sit on our advisory board for the makerspaces, including folks from libraries, Chicago Public Schools, We had folks from the Museum of Science and Industry helping out on our projects. And then, like I said, some other folks from universities, including Northwestern, for instance. And so we began to reach out to people to get them involved in the production of PPE so that it wasn't just a DePaul thing. And that quickly expanded into hundreds of volunteers all around the city of Chicago and all around the suburbs helping us make stuff. Our goal was to meet short-term needs until the supply chain catches up. In other words, the reason we had to make PPE was because there was a huge shortage. The reason there was a huge shortage is because all the supply chains had broken down. Things from China weren't getting here. Things weren't being fabricated, even in the United States, because a lot of places had to shut down. And so there was a huge material shortage and a huge PPE shortage. And we figured eventually things would catch up and we would be able to move on and do whatever else it is that we needed to do. So we got the machines in other places. We networked other folks into this large group of people in the state of Illinois making things. And then we needed to start getting materials and funding because, of course, making all this stuff costs a lot of money and takes a lot of resources up. So what we did was we created a fundraiser page, and I'm going to be linking to that at the end of this slide, where people could donate money so that we can make PPE for those in need. We also got very fortunately, a lot of partners on board from places like the Julian Grace Foundation, Accenture, Dremel, Coca-Cola, Newark, a lot of great Chicago companies and Illinois companies who really decided that this was the good and right thing to do to help, doctors, frontline workers, and everybody else stay safe and healthy. So we got printers out of our spaces. I'm just kind of back on the story again. Printers out of the spaces. We got a lot of other people involved, and then we started raising money and bringing in materials to make stuff. And then we began distributing all of these materials to fabricators. Jake, I'm wondering, being one of our primary fabricators, if you could tell people kind of what that was like as a person who is both making stuff, and then I'm going to move ahead in a second, and you can talk about how the distribution process as well.
Sure thing. So it was a really fun experience for me, having had almost 2 years of 3D printing experience in DePaul's labs. It was interesting for the first time having access to that, in my home. I was really happy that DePaul was so quick with their approval of the dissemination of these technologies because, right when the last quarter ended before the lockdown, myself and my fellow employees were a little worried about, whether we'd have access to be able to, make this personal protective equipment, with the massive amounts of 3D printing and technology that we have. So again, setting up shop in my home was, it was a change in my schedule. I would, get up every morning and, remove all the prints from the bed and then start the next prints. So I had a almost 24-hour cycle going where during the day would be a certain set of prints and then over the evening would be another set. And that was all mainly in the effort to produce hundreds of these plastic frames. But this wasn't the only type of product we were producing. On top of these, which were designed by Josef Prusa, a 3D printing manufacturer and maker in Czechoslovakia, that design had also been edited to fit on smaller print beds. As you can see, this one is about 7 inches wide by 5 inches tall. So that, that cuts out a lot of smaller hobbyist 3D printers. So, we've also been printing large amounts of these designs, which is the same thing, just kind of crunched in on itself so that it can fit on smaller printers. And on top of that, once we started to actually meet the local demand for these larger frames, we were met with an overwhelming demand for these much smaller and simpler prints, which are ear helpers for N95 masks. So an N95 mask has 2 bits of elastic that go up and around the ears. And when our medical staff is wearing an N95 mask for sometimes 14, 15 hours per day, it puts a lot of strain on the back of their ears. So this little simple device, which on its own probably takes about 20 minutes to print, goes around the back of the head, and then you hook the elastic onto that instead. So all of the strain is being cradled on this device around the back of your head rather than just the ears. And it was really interesting to see that, we can print thousands upon thousands of these just because they're so much tinier and so much quicker to print. And, it was really humbling to see the response that we got from the, local hospitals. Advocate South Central, name comes to mind, where a friend of our family is a doctor there, and we were able to pretty much single-handedly set up their entire staff in the OBGYN clinic with personal protective equipment because their hospital was just unable to meet the need given the current, supply chain problems that Jay had mentioned earlier.
Yeah. So this group that we're talking about, Jake being a part of it, DePaul being a large leader in it, then became something we're calling the Illinois PPE Network, which has to date delivered over 100,000 face shields, and I don't even know, countless face masks to all sorts of institutions and organizations in need. And primarily during the early days of the pandemic, we delivered to over 50 hospitals and healthcare institutions just in the Chicago area. And 50 is a very low number. I would actually say over 100 of those institutions from probably between March and June. So how do we, how do we do this network? How do we build it? And what does it look like? And what's the reasoning behind its composition? That's the next thing I want to talk about, because I want other folks to kind of understand, I think, kind of how we frame this entire endeavor out, and how other people might be able to copy this, not just for PPE efforts, but for other kind of things as well. So the first thing is that we continue to operate using what we call a node-like fashion, and I hope a lot of folks who are alums from CDM would probably recognize the ideas of nodes and mesh networks. You may also have recognized ideas such as anti-fragility from Nassim Nicholas Taleb, who wrote The Black Swan and other sorts of things. But we designed our network to operate in a node-like fashion where we had groups of individuals working out of their homes, and then we had hubs where those groups of individuals were part of a geographically similar space, and they were serving geographically places that were located geographically near them as well. So if you're down in the south suburbs of Chicago, you might be grouped with other people in the south suburbs of Chicago. You're not getting together to make things, you're staying in your own homes to make things, and then you deliver to locations near you in the south suburbs of Chicago. And what this does is it creates this multiplicative effect where instead of centralizing everything and therefore creating an additional risk for transmission and shutting your operation down, and also, instead of centralizing everything, which actually reduces its growth because it reduces the ability for volunteers to get involved from all sorts of geographically diverse locations, we created this node-like network, which gave us the ability to multiply almost as fast, I would say, as the virus itself. So our network building is viral in a certain respect as well. It also is a great way to be a grassroots response where you're taking if you have a pandemic affecting everybody around you, the first people you take care of are the people within your immediate circle or the people within your immediate geographic location, and then you move out from there. And so once you're taken care of and once you're safe, you can kind of move out and expand and help other folks around you. And it also, is very practical. People didn't have to travel far because they're supposed to be at home anyways. And I would still say people should be staying at home as much as they possibly can right now, especially considering that Illinois is on the rise a little bit, especially, particularly in areas where we're near adjacent states that aren't doing so well. So that's one. That's why we built it as a node-like network. It was not just for resilience, but for robustness and for anti-fragility, and so that it could grow very fast. The second thing I want to talk about is we mentioned Illinois PPE. So why Illinois PPE instead of being a national effort or a worldwide effort? Well, first, very pragmatically, everything's rolled out as a statewide effort when it comes to the pandemic's response due to the lack of response at a greater level. And so if our state is on its own, we decided that we were going to help our state. And then as we had overflow, we began helping other states as well. So that very pragmatically, why is it Illinois PPE? That's how these solutions have rolled out. And then, like I said, once we take care of the south suburbs, we take care of other suburbs in the city of Chicago because we have spillover from our nodes here. And then once we take care of that area, we send things out to other places, Rockford, Peoria, et cetera. And once we take care of those places, then we send things out to hospitals and places in Detroit, in different cities in Missouri even, and many other places. So, it's kind of, it grows out from there. But, first you take care of that core group. And then finally, like, why do we do delivery not just via mail, which we do, but why do we do delivery, through the way we get things from point A to point B is primarily through volunteers, through medical students, and through bike couriers. And the reason we do that is because there's a human element to the deliveries that we're doing. And Jake, I was hoping you could talk a little bit about that delivery element. And I know you already mentioned the gratitude of some folks who are receiving those deliveries, but I'm sure there's some other stories that you can throw in there too.
Sure thing. So I guess to start off, I should say that I live in the south suburbs. Like anywhere south of us is just open farmland. So that really limited the amount of bike couriers and volunteers that we had out here. So in my house, I was able to produce several hundred masks, and it was just easy for me to take a quick 10 or 15-minute drive out to wherever needed to have them. The picture here is the Joliet Dispatch Center that kind of supplies the EMT and law enforcement officers throughout that entire Joliet and Frankfurt and Mokina area. So that's a perfect place to hit with, in that image, you have 300 of these PPE masks which go out to EMTs and first responders. And it was just, it is, Jay said the human element is a big part of it. And it was really great for me to be able to, speak briefly with the people I was helping to understand, what they're going through in this, current time. I got to talk with doctors and nurses and medical staff who, just the addition of this one extra piece of protection to their daily repertoire was something that gives them that sense of security that helps them to keep working, to keep fighting this. And, not to say that, having all of this delivered over the mail mitigates any of that help. It just, it helps garner a connection between the makers and the people who are receiving our the things we make.
Yeah. And, I think an interesting thing to point out, Jake, we did some work with Will County EMT, for instance, but a lot of these institutions had, hundreds of people who were on the front lines and no protective equipment, especially early in the pandemic. And so just seeing the relief on some of their faces when they received these things was a reward in itself to know that we could help keep people safe and healthy.
And it is heartwarming because, just to say briefly, one of our family friends, a friend of our family, is an OBGYN doctor, and they had to go into this dealing with pregnant mothers in the same building as COVID patients, and their hospital was not able to give them anything. They had no N95 masks, no gloves, and no face shields. So through our efforts in the Illinois PPE Association, we were able to basically single-handedly protect that part of the hospital with our equipment.
Yeah. And the pictures that I have on here are just illustrative. These are ER doctors in this picture who had no face shields when they were taking care of and intubating their patients. So the way that we identify those needs is really simply through our website, which I'll have a link to at the end of this slide. And those needs started out with hospitals and other institutions, but have quickly, especially in the past month, ramped up to include schools, which are scrambling to address the reopening mandates from their various superintendents and so forth. So, all right. So, what are our next steps? And then I want to open it up to Q&A. So I want to kind of hopefully get through this pretty quick. Well, when you talk about next steps, first thing you have to address is what the problems are, and then why are you have how are those next steps addressing those problems? Well, one is that the supply chain for a lot of things, including plastic and plexiglass, have really not caught up to the demand of these pieces of equipment. So schools are rapidly finding that things like those splash guards that go on receptionist desks are either impossible to find or incredibly expensive. And so as that supply chain continues to struggle to catch up, institutions are still in need of this equipment, and we intend to help them get that through the fabrication and the resourcefulness that we hopefully have. The second thing, and this again is related to schools in particular, as they're a big focus right now of our efforts, is that they're trying to figure out how to reopen safely and they don't often have the resources to open responsibly. So this is the same kind of thing we heard from hospitals, is that, for instance, gowns aren't in shortage. It's just that they cost too much and hospitals are going bankrupt right now. Same thing with schools. We don't know what the next bill is going to look like from the federal government to address funding for schools and protective equipment. But we do know that schools do not have a lot of funding. K-12 schools I'm talking about in particular don't have a lot of funding for these kinds of things. And so even though some of these things might be out there, it's very difficult for educators to get their hands on protective equipment and other things to make the built environment a safer place to navigate. So those are the problems, and as a result, we have some next steps. One of the things that we're doing that, I'll leave it towards last because I like this one the most. One of the things we're doing is we're providing everyone with PPE that they need. So that's our two big goals: provide everybody with the masks, shields, and other things they need in the state of Illinois. The second is that we're working on resources to help schools and institutions responsibly open. The third is that we're fabricating, all sorts of facility opening equipment. And then the fourth thing, and one thing that Jake's probably printing right now, is that we're doing consulting as well through the IRL on COVID-related projects. And what that looks like, Jake, I'll let you talk about before we talk about how we're going to get to those next steps.
All right. So, like Jay said, one of our key goals is to find ways to help institutions safely open. And one company that is doing something on that front is a company called Proxfinity, which has been connected to Jay and I through the Robert Bosch Tool Company. And essentially, they're creating these RFID badges, which will be produced en masse and given to members of institutions, whether that be large-scale companies or schools or universities, where this will help keep track of social distancing policies. They can keep track of who is close to who, so that in the event of another spike in the outbreak, we can get on top of it and see who's had contact with people who have now been tested positive. And with this massive amount of technology comes the kind of mundane task of charging all of these separate electronic devices, which is where my recent 3D printing efforts have gone towards designing and producing this charging box, which when it's assembled, it will have USB ports along the bottom that the badge will be able to slot into, and you'll be able to charge 10 of these at a time. And I'm producing 40 of these that are going to be able to charge 400 of these badges at once. Now, it was only through the connections that Jay has garnered through the PPE development that I was able to connect with the company developing these badges in order to design for them the large-scale charging solution.
So in addition to fabricating our own things that help people in our state, we're working with companies to help fabricate things so that they can help other folks as well. I think that this is a great example of a private sector partnership where universities have a certain set of knowledge and capabilities that can help them help other people. So how we'll get there, and I want everybody on this webinar to treat these how we'll get there as also possible jumping off points for you to participate in anything that we're doing. One is that we're going to continue, we are continuing to grow our volunteer base. We have over 120 potential volunteers from Accenture who just joined our program. Early on, Bosch produced, I think, about 30,000 face shields on their own. So all those partnerships and our volunteers in our group were educators and CPS and so forth, have been a huge help, and we continue to look to grow that. The second thing that we're doing is that we're engaging in the manufacturing process. So we started out in the bedroom, but now we're moving into smaller job shops and manufacturing facilities within the state. So one example is Triangle Die and Supplies that produced a die, which is like a cookie cutter for us. And we used that cookie cutter to punch out a bunch of different plastic shields. And so now we're able to make about 1,800 shields a minute. And we're navigating that space as best as we can, being educators. We're not necessarily at scale manufacturers. And so that's another area that we look to continue to grow in with either tooling, dyeing, or the development and the development of molds and things of that nature to up our manufacturing capabilities. We've raised about $120,000 in that pursuit, but we need to continue to raise funds to pursue the growth of this, especially as schools start to open and the need for things continues to increase rapidly. We're creating materials that combine best practices for educational spaces with the equipment that backs up those best practices. So not only recommendations on how to open your institution, but the actual resources you might need to do that, including face shields, masks, and so forth. And then we're expanding. Really, the other very important thing is, even though the requests that we're getting are coming in at an ever-increasing rate, I know that they don't represent the need that exists in the state of Illinois. And so any assistance in expanding the awareness of our efforts will help us so that we can meet the demand that we know exists out there. So that's the end of what I have. I've got 2 links for folks here who want to do any follow-up, and I can share these slides. We can send out to folks after the webinar. But if you want to volunteer in our efforts, donate to our efforts, or request PPE for any institution that you work for, go to illinoisppe.org. Everything that we do is nonprofit and free, and all the funds go through DePaul. And if you want to follow the makerspace stuff that students like Jake are working on, just check out our website, irl.depaul.edu. And that's where all of the blog posts that we do about our makerspace stuff, about our PPE work, which are all these things written by students, by the way, just like you were when you were at DePaul. All of this stuff is on our website too. Jake, did you want to close with anything?
I just want to say that it's been a wonderful experience being able to use this technology to help others. And, I'm thankful to DePaul for having the resources to be able to allocate to students like myself to be able to, put their passions to making towards something, ultra productive that, has definite impact on the way we are treating this current crisis. And, and we're all better for it.
Awesome. Well, I want to thank you both, not just for presenting today, but also for all the incredible work you've done addressing such an important need in our communities yourselves, and both all, of course, all the organizing you've done as well. So yeah, thank you both so much. If anybody has any questions, feel free to chat them to me, and I'll be happy to share them with Jay and Jake and Dean Miller, of course, as well. If anybody has any questions before we wrap up.
Don't be shy.
Yeah.
Your one opportunity.
And while we're waiting, for some people, hopefully some people are typing and whatnot, we'll also note that if you have any questions about the presentation, of course, these links are great resources as well. We'll be including those in the post-event email, and this session will also be available if you're interested in rewatching it on our alumni blog. So yeah, just a quick note there. We haven't gotten any questions yet, but it looks like people are hanging around. So if you have any questions, like I said, we still have a couple minutes, so feel free to submit them to me in the chat.
Well, while we wait, I have a question for Jake while we wait for other folks, and I'm interested in this. That the interesting thing about these makerspaces that we have at DePaul is that they're not just places that produce artifacts, and in fact, the things we make are always really less important than the process itself, and you can't take things with you anyway, so things aren't very important, I guess is what it boils down to. And I think while we focused on PPE and the things we make, there's a lot of education that happened in the production of these things. And I'm wondering, Jake, if and what you learned in the process of addressing these PPE needs in the state as a student at DePaul and now alum.
Sure thing. Yeah. So, in my experience working at the IRL, I became well versed in, many different fabrication techniques, 3D printing being part of that. And what sits behind 3D printing is the actual design part of it. We were fortunate enough to have these designs already spoken for, where they were developed by a developer of 3D printers from Czechoslovakia named Josef Prusa. He created an incredible design, but it came out pretty slowly at first, where first his design was, I guess, as you can see right now, this design is developed for a standard US 3-hole punch, so that I can just 3-hole punch these sheets of plastic and they line up perfectly with the pegs. Since Josef Prusa is based out of Czechoslovakia, this wasn't the case initially. It had a Czechoslovakian standard 4-hole punch along the outer rim. So, as makers started, modifying these types of, these designs to, fit a standard 3-hole punch, there came a immediate need for, taking a design and modifying it in some way to, fit your personal needs. Although I was able to just find a nicely designed standard US 3-hole punch one part of the design that I did have a play in at first was a stackable version of it, where Prusa himself had a stackable version of the 4-hole punch one that allowed you to print 4 at a time, just one on top of the other. Whereas as the 3-hole punch ones were starting to come out, they only came out in single units, which allowed you to only print one of them at a time. So to fit my immediate needs, I was able to use the 3D design knowledge that I garnered at DePaul in order to, modify that type of design to fit my own needs. And that evolves itself into the multiple charging unit for the COVID badges, because I was given this badge from the company as something that they designed, and using Fusion 360, I was able to fabricate this entire object, design it from the ground up in order to have the slots fit perfectly with the badges, and then in order to have it be able to open up and have access to all the wiring and electronics that will go inside the empty box. Unfortunately, I don't have a fully assembled one with me right now, as I just finished my most recent delivery to them, but you can just imagine a giant rat's nest of wires inside there that you have to design spaces to fit. And it was, I had worked with 3D design before, developing small scale things like cases for my headphones and other little phone mount car holder stuff. But this was kind of the first object that I designed from the ground up to be produced on a mass scale. I have dozens of these things that are going to be coming out of my house right now. That is it's a manufactured product, and it's a very interesting type of experience to having spent a few years just developing things for myself to print one at a time, just for me and those members closest to me. Now applying those skills to something that's going to be produced en masse, hundreds if not thousands of these could be produced in the future, and it's just a rewarding experience to be able to design something that using 3D printing can be sent out to hundreds of people.
Emily, I don't want to monopolize anything, but I have one more question. Is that okay?
Yeah, absolutely. If you guys have the time, we had 2 questions come in.
Oh, good.
If you guys are
go ahead
for a little bit, then yeah.
Okay. Well, and then I'll stop. I'll be quiet after this, unless the questions are for me. My question is for Dean Miller too. I've got you on the hot seat. Not really though. What do you? Why do you think? We mentioned during the presentation that DePaul was it was really the first institution in Chicago to step up and do something about this, and why you think, and how you made that decision, and why you think CDM and DePaul were uniquely positioned to, I don't know how to say this any differently, do the right thing where other institutions were bound a little bit differently by whatever processes that prevented them from helping out.
You're talking about the PPE production stuff specifically? Yeah. Well, it started with you, frankly. I know you weren't fishing for a compliment here, but the fact is that you approached us with the idea. It wasn't that it got generated anywhere else. So thank you for that, and you've been, you're a great generator of ideas, and I think you look outward and you look at how we can contribute. I think what we could do quickly is we don't have a lot of red tape. I mean, yeah, I've got to deal with the asset management people and and the usual sorts of corporate things. But frankly, you brought the idea forward. We pushed up the line very quickly through the provost and other related offices, and it's kind of like it took a day. People were so excited by the idea, the notion that we could take what we had that was otherwise just going to be sitting fallow, with us being shut down, and to turn it to something productive and useful to our healthcare providers and other frontline responders. I mean, that just so resonated with what DePaul views itself as being part of its image and identity and mission, that, you know, two things. We want to do things like this. It's important to us, and we know how to get out of our own way to make things happen. So.
All right, what question, Emily, you said there were a couple questions?
Yeah, we'll start with one for Dean Miller. It says, distance learning has been a very big hurdle to climb, especially on the K through 8 level. Can Dean Miller discuss or address some of the challenges that they have faced at DePaul in continuing this offering, and what can K through 8 programs learn from these challenges? And then it continues on. It seems that K through 8 organizations can only really set up weekly or bi-weekly Zoom chats. Do you have any, and if you have any thoughts to share on if it's related to funding or different factors?
Well, I'm really not the expert on K through 8. My recommendation would be have older students. That, you know, the challenges being faced by the educational system at that level boggles my mind. I mean, you have even greater demands for the need for socialization, and, you know, the ability to, you know, stay on task and focus is a wholly different ball game at that level. Our work in higher education is simpler. I mean, you think about a traditional class is really, it's 3 contact hours a week for a class. You may have additional supplemental materials, of course, and readings to do, and you're dealing with adults here who, you know, even our freshmen have already been through, you know, 13 years of school. They by that time they've got some of the ideas of discipline and focus, and it's different than trying to take in a much more immersive situation of a K through 12 situation where you're expected to be in class all day, and you know, the contact hours are tremendous. I don't know how you translate what we know and do, because our job is actually so much simpler. And I'm going to leave it at that, because I don't have kids to deal with at that level. So.
Sounds good. Well, thank you. And then the other question was more for the IRL team. What are your plans for expanding distribution? It says, I saw you were using small parcel carriers, but are there any plans eventually to work with third-party logistic companies, or, so yeah.
So I can say that we have been speaking with some folks at Accenture who are experts at that and know more about that than I do. And what I really mean to say in that response, or what's embedded in that, is if whoever's asking that question was asking that as a leading question because they have access or knowledge that can help in that regard, we would love to connect them with our efforts, because of course we're not experts in everything, and so you defer to people who have expertise in areas when you have that resource available to you. Did that answer the question? I hope it did. Okay.
I think so. If anybody has any follow-ups, obviously we have the chat. I know we're over here, but just one last quick question. One person asked if there's any way that the makerspace can be used by online students. So I know you guys have blogs and some different things that you pushed out, so just figured I'd give you an opportunity to share some information about that as well.
Yeah, a couple key things that we're doing. One is that we have been delivering kits to people's homes where they can then make things with us. We do like a guided video that's live, and then people get these kits delivered to their homes and they can follow that guided video and make things. So for instance, we did a pickling kit where people got pickling materials delivered to their homes, and then one of our old lab managers, Thomas Newsom, did a live stream video where he literally just went through the entire pickling process, and other people were able to do that follow along at home. Got a bunch of great pictures from faculty and students who participated in that. So that was a really fun one. So that's one thing, is that we're doing kits that people can get delivered to their homes and participate. The second thing we did is we invested some of our resources at the end of the prior fiscal year into developing almost like tool checkouts, like libraries. But instead of books, you get tools delivered to your homes. And that's to support students who are perhaps in courses where they need to do hands-on things, but that's also just all students. So if you are interested in getting involved with the hands-on kits that we're doing, or in getting tools delivered to your home for some extended period of time to work on things remotely, those are two resources that we have available, and you can find out more information on our website.
Jay, you want to talk a little bit about the course you've developed?
Oh, yeah, sure. We also have a pilot for a certification program that's going to be coming out starting this August, I think is when the pilot begins. And it's to be to get certified in innovative making, in particular in Internet of Things. And so it's a completely free course where students who are enrolled in it will get materials for free delivered to their homes. And then they will have instructional guidance from both myself and Jake, as well as from our partners at our collaborators, sorry, not partners, our collaborators at Bosch, who will be joining some of those calls as well. So for students who want to do things at home and receive credit and certification for their work, we are opening that up for IoT, and in the future are looking to do that with things like digital fabrication and other potential certifiable things. And that will all be through CDM. So that's a pretty cool thing, I think. And all free.
Yeah, I'm personally excited for that program because one of my favorite things to do as an employee of the IRL was to teach our student visitors, all of the tools of the trade. My specialty was 3D printing, but I also taught courses through the IRL in laser engraving, vinyl cutting, heat pressing, and woodshop activities. So being able to apply that towards a online certification in things like digital fabrication, IoT, it's a great experience for me to keep that part of the IRL that, while I was still able to keep the 3D printing and fabricating aspect, the teaching aspect was a little bit lost during this crisis. So to be able to get back to that is going to be a fun experience for me.
Awesome. Well, it looks like that's pretty much it for the questions. Again, I'll just reiterate that we'll be sharing all of these resources, the important links to IRL, how you can learn more about getting the packages Jay mentioned shipped, and how you can help support IRL in our post-event email. But before we wrap up, I just want to thank everyone again, Jay and Jake, and of course Dean Miller as well, for taking the time to chat with some of our alumni today, and of course for all the incredible work again that you guys have done over the course of the past few months. So thank you guys so much, and thank you everyone for joining us, and enjoy the rest of your afternoon.
Thanks so much for having us.
Thank you.